Prenatal health care. The key to protecting the health of your child is to get regular prenatal care. If you think you're pregnant, call your health care provider to schedule your first prenatal appointment. At your first visit, your healthcare provider will probably do a pregnancy test. Based on a physical examination and the date of your last period, your health provider will probably know how many weeks of pregnancy you have. If you're healthy and there's no complicating risk factors, most healthcare providers will want to see you every 4 weeks until the 28th week of pregnancy, then every 2 weeks until the 36th week. Finally, once a week until delivery. Throughout your pregnancy, your healthcare provider will check your weight and your blood pressure while also checking the growth and development of your baby. During these visits, your doctor probably will do things such as feeling your abdomen, listening for the fetal heartbeat starting during the second trimester, and measuring your belly. Nutrition and supplements. Now that you're eating for 2 or more, this is not the time to cut calories or go on a diet. In fact, it's just the opposite. You need about 300 extra calories a day, especially later in your pregnancy when your baby grows quickly. Healthy eating is always important, but especially when you're pregnant. So make sure your calories come from nutrition foods that will contribute to your baby growth and development. Some things to avoid. When you are pregnant, what you don't put into your body or expose your body to is almost as important as what you do. Here are some things to avoid. Alcohol. Although it may seem harmless to have a glass of wine at dinner or beer out with friends. However, one of the most common known causes of mental and physical birth defects, alcohol can cause severe abnormalities in a developing fetus. Recreational drugs. Pregnant women who use drugs may be placing their unborn baby at risk for premature birth, poor growth, birth defects, and behavior and learning problems, and their babies could also be born addicted to those drugs themselves. Something else to avoid is the nicotine. Pregnant women who smoke has nicotine and carbon monoxide to their growing babies. The risk is the following: prematurity, low birth weight, sudden infant death syndrome, and asthma and other respiratory problems in the child. Something else very important to avoid is caffeine. This one can increase the risk of a miscarriage, so it's probably wise to limit or even avoid caffeine altogether if you can. Last but not least, over-the-counter and prescription medicines. Even common over-the-counter medicines that are generally safe may be considered off limits during pregnancy because of their potential effect on the baby. And some prescriptions medicines may also cause harm to the developing fetus. Postpartum depression. Women with postpartum depression have intense feelings of sadness, anxiety, or despair that prevent them from being able to do their daily tasks. Postpartum depression can occur up to 1 year after having a baby, but it must commonly start about 1 to 3 weeks after childbirth. What causes postpartum depression? Postpartum depression is caused by a combination of factors. These factors include the following: changes in the hormone levels. Level of estrogen and progesterone decrease sharply in the hours after childbirth. These changes may trigger depression in the same way that smaller changes in hormone levels trigger mood swings and tension before menstrual periods. History of depression. Women who have depression at any time before, during, or after pregnancy, or who currently are being treated for depression have increased risk of developing postpartum depression. Emotional factors. Feeling of doubtful about pregnancy are common. If the pregnancy is not planned or is not wanted, this can affect the way a woman feels about her pregnancies and her fetus. Even when a pregnancy is planned, it can take a lot of time to adjust to the idea of having a new baby. Parents of babies who are sick or who need to stay in the hospital may feel sad, angry, or guilty. These emotions can affect a woman's self-esteem and how she deals with stress. Fatigue. Many women feel very tired after giving birth. It can take weeks for a woman to regain her normal strength and energy. For women who have had their babies for cesarean birth, it may take even longer. And lifestyle factors. Lack of support from others and stressful life events, such as a recent death of a loved one, a family illness, or moving to a new city. If I think I have postpartum depression, when I should see my healthcare provider. If you think you may have postpartum depression, it's important to see your OBGYN or other healthcare professional as soon as possible. How is postpartum depression treated? Postpartum depression can be treated with medication called antidepressants. Talk therapy is also used to treat depression and often is combined with medications. What are antidepressants? Antidepressants are medications that work to balance the chemicals in the brain that controls the moods. There are many types of antidepressants. Drugs sometimes are combined when needed to get the best result. It may take 3 to 4 weeks of taking the medication before you start to feel better. Can antidepressants cause side effects? Yes, antidepressants can cause side effects, but most are temporary and go away after a short time. If you have severe or unusual side effects that get in the way of your normal daily habits, notify your OBGYN or other healthcare professional. You may need to try another type of antidepressant. If your depression worsens soon after starting the medication, or if you have thought of hurting yourself or others, contact your healthcare provider or go to an emergency room.